So thank you to everyone who is joining us. Thank you for spending your Wednesday evening with us. We're going to get started because we have a lot to cover. We want to make sure that we have enough time for questions. So let me introduce myself first. My name is Mary Schaefer. I'm the Marketing and Communications Manager at Jericho Road Community Health Center. I will be the one compiling your Q&A questions today and then bringing them to our presenters after they finish with their prepared remarks. So if you're watching on Zoom, you can submit a question using the chat function by clicking the chat button, which has the little speech bubble at the bottom of your screen. And once you get the chat function popped out, you can use the drop-down menu to select either everyone, and then everyone will see your question, or you can select my name, Mary Schaefer, and then that will be a private message that's sent just to me, and only I will be able to see your question. And I'm not going to attach names to any of the questions. The questions will be asked anonymously. If you're watching the live stream on Facebook, you don't have the private option, but you can still submit a question by writing a comment on the video. So with that out of the way, I'm going to quickly introduce our hosts and then they will take it away. So first we have Dr. Allana Krolikowski. Dr. Krolikowski is our Chief Medical Officer and a family physician. She received her medical degree from the University at Buffalo and completed her residency at Greater Lawrence Family Health Center in Lawrence, Massachusetts. She has also lived in and trained medical professionals in Malawi. Next is Takisha Leonard, a registered nurse, family nurse practitioner, and doctor of education. She received her medical education at both the University at Buffalo and U of L College. Takesha is our East Side medical director and oversees our practice at Broadway. She previously also led our site at Genesee Street. And finally, we have Dr. Luther Robinson, a pediatrician and the student program director at Jericho Road. He's also Emeritus Professor of Pediatrics and Genetics at UB's Jacobs School of Medicine. Dr. Robinson received his medical education at University of Cincinnati and completed his residency training and postdoctoral fellowship at the University of California at San Diego. Prior to joining Jericho Road, Dr. Robinson served as Director of Dysmorphology and Clinical Genetics at Women and Children's Hospital for 30 years. His research focuses on environmental agents that cause birth defects, such as alcohol, and he's an expert in fetal alcohol syndrome. Dr. Robinson was an inaugural member of the National Task Force on Fetal Alcohol Syndrome and Fetal Alcohol Effects, and has also been a research associate for the National Institutes of Alcohol Abuse and Alcoholism. All three of these medical providers are heavily involved in direct patient care every day at Jericho Road. Takesha has been consistently working in our COVID isolation units, testing and diagnosing hundreds of COVID cases throughout the pandemic. And Dr. Krolikowski has been caring for COVID patients in the hospital. So all three have a lot of experience. So I'm going to turn it over to Dr. Krolikowski to start things off.
Good evening. Thank you everyone for joining us. So we're going to split it up between the three of us and share some different things about the vaccine, and specifically things that we think you may have questions about, but then obviously, like Mary said, we'll open it up for Q&A after. So one thing that I'd like to talk about is about vaccine development. So I even had a patient today in the office when I said, do you want the vaccine? They said, well, it was developed way too fast. And they said, HIV has been around forever and there's no cure for that or no vaccine for that. How should I trust this vaccine? So it is true that vaccines are usually developed over a number of years, but there are many contributing factors. Scientists need to find the technology that works for that particular disease and then do pre-human trials. They will then often wait months for approval to begin testing in humans. Then there are 3 phases of human trials to test safety and effectiveness. And then we often wait a long time for the FDA to review these studies before we can begin widespread vaccination. Phase 4 is post-approval monitoring and research for ongoing safety monitoring. In this case, we know that the vaccines that have been developed didn't have to wait for all those approvals, red tape. It was expedited to review the data that existed. But we do know that the vaccines, the 2 that are on the market now, Moderna and Pfizer-BioNTech, both had significant numbers of participants in the phase 1, 2, and 3 trials, which are consistent with previous vaccine trials. So they didn't skimp on safety and effectiveness. They did those trials before it went to market. The Johnson & Johnson vaccine will be reviewed by the FDA, and then we'll know more about that one as well. So when COVID-19 emerged as a new virus with serious consequences, scientists all around the world started working on a vaccine as early as January of 2020. There are many different technologies that can be used for vaccine development, but the two that have received FDA approval in the United States so far both use the same technology of messenger RNA or mRNA. These are the first mRNA vaccines approved for preventive use, but the mRNA technology is not new. It has been studied for decades for other purposes, such as immunotherapy for cancer. The way that these vaccines work is that they deliver a synthetic or man-made version of the mRNA used to create the coronavirus spike protein. You're not injected with live virus, so you cannot get COVID-19 from the vaccine, and you cannot pass COVID-19 on to anyone if you get the vaccine from the vaccine itself. The mRNA genetic material enters your muscle cells at the injection site, but it is not able to enter the nucleus where your DNA is located. Therefore, it is not able to alter your DNA. Your cell's ribosomes then use the mRNA to create the spike protein, and then the cell breaks down the mRNA and gets rid of it. Then your cell puts this spike protein on its surface. Your body recognizes this as foreign and then mounts an immune response. Then you create the antibodies and other immune functions necessary to fight COVID if you're exposed in the future. The Moderna and Pfizer vaccines came more quickly than other technologies because synthetic mRNA can be created in less than a week. Scientists have been studying this technology for years, and they had finally learned how to keep it stable. Production can also be ramped up quickly and safely. mRNA technology has been used in phase 1 trials for Zika virus, rabies, and influenza. And as I mentioned, in the vaccine trials, a significant number of people were injected. So more than 20,000 people were injected with the Pfizer vaccine and more than 15,000 with the Moderna vaccine in the phase 3 trials, with a comparable number of participants injected with the placebo. So I'm going to turn it over to Takesha now. I think you're going to talk about side effects and things. Am I right? I don't have the agenda right in front of me.
Yeah, so I'm going to talk about some of the most common side effects and why we have side effects. So just more personally, I did receive the Moderna vaccine. I received both doses. I received my first dose in December, and 28 days later, I received my second dose. After the first dose, I was absolutely fine, went back to work, had a good day, no problems. That second dose, y'all, was a little bit tougher. So I got the second dose about 4 hours later. I started having some hand pain, which I was like, okay, maybe something is going on with the vaccine. I don't know what's happening. By the end of that evening, I had body pain, like pretty significant body pain. I had to take Tylenol, drink lots of fluids, and it was a full 24 hours of just like joint pain. I didn't have a fever or anything, but severe fatigue. It lasted 24 hours. And the next day I was 100% back to normal. So what that means is that your body is developing the antibodies against COVID. And so it's ramping up all that protection. And so you may have some side effects, as I did. Some of the side effects include fever. Some people experience that. Body aches or myalgias, which I experienced. Significant fatigue and pain at the injection site, which is not uncommon from what we get when we get our flu shots or our regular vaccinations. It's just some pain in that area. And so typically those symptoms can last anywhere between 1 and 3 days. And that's the greatest that I've heard from personal experience. So, it's not uncommon to, get some of the side effects. You may have to take Tylenol. Some people have to call in to work the next day. I did. I don't call into work ever, but this day I did call into work and stayed in the bed and just kind of, let the vaccine do its job and felt a lot better the following day. But what I will say is this, guys, I'm here, I'm alive, and I'm fine. With the vaccine, there is a potential to get side effects such as the ones that I mentioned. With COVID, it's so unpredictable that you cannot predict the response that your body will have to COVID. many people have very mild symptoms of COVID where they might just have a cough or cold or loss of taste and smell. And that ranges to severe where you end up in the hospital and even potentially death. COVID is unpredictable. You cannot predict just because you're young, you're healthy, black, white, obese, diabetes, high blood pressure. It has no picture of who it's going to attack in what way. So, my purpose of this session or this little section right here is that, yes, I had some side effects from the COVID vaccine. I had body pain. I had to call into work for 24 hours, but I'm still here. And I can't say that that would have been the same outcome had I gotten actual COVID. So thank you for that.
So I think I'm going to talk a little bit about special populations because there's questions that come up about that. So one is breastfeeding women. So breastfeeding women were not included in the trials. They definitely should have been, and we don't withhold any vaccines from any pregnant woman. From any breastfeeding woman. So there should be no reason that this wouldn't be safe in a breastfeeding woman. In pregnant women were also not included in the vaccine trials. The Society for Maternal Fetal Medicine said that they should have been included because we know that pregnant women are at higher risk of having severe COVID. We've seen across the country, pregnant women have higher risk of preterm labor when they get COVID. The data is not really out there yet, but we're seeing that women could have a higher risk of stillbirth and potentially miscarriage, although you probably won't read that, but there's a number of us that are anecdotally seeing that. And also increased risk of being in the ICU and of dying if you're pregnant and you get COVID. So they weren't in the original trials. People are now following pregnant women who decided to get the vaccine. And from what we've seen so far, it is safe. So pregnant women are included in the list of high-risk populations that are now eligible to get the vaccine in New York State. I myself am currently pregnant and did decide to get the vaccine. And my second dose wasn't actually that bad, so not as bad as Takesha's. Then, there's people who have a history of anaphylaxis or severe allergies to different things. Really, the only contraindication of someone who has a history of allergies would be if you had a history of anaphylaxis to a component of the vaccine. So you would know that if you've had a severe allergic reaction to a vaccine previously or an injectable therapy. And if so, then you'd want to see if you could figure out what you were allergic to and if there's similar components between what you received and the ingredients in the vaccine. As far as people who have had COVID already, the CDC does recommend that they do receive the COVID vaccine. You have to wait at least 14 days after you've been diagnosed to get the vaccine. We know immunity is probably good for at least 3 months. And so you could choose to wait that time if you want to wait to get the vaccine. But we do recommend that you get it. There are some recent studies you may have seen coming out saying, do people who have had COVID before, do they only need 1 dose instead of 2? Those are just sort of things that are starting to come out, but no formal recommendation from the CDC about that. And then the last thing on here that I have is there's been concerns about, people had out about potential fertility issues. Like, if I get this vaccine, will it make me infertile? Will I not be able to have a baby? And there's really no scientific basis for that. The mRNA gets broken down pretty quickly. It's highly unlikely to cross the placenta. That's really what made me think, like, I'm going to get this vaccine as a pregnant woman. It doesn't alter your DNA. I don't really see how it could affect your fertility. And that's what the fertility experts around the country are saying as well. What we do know is that COVID itself can decrease your fertility. So for the first few months after getting COVID, if you were to get COVID, you can have decreased fertility after that. So I'm going to hand it over to Dr. Robinson. who is currently muted.
One more time with feeling. So, good evening. My name is Luther Robinson, and I'm a pediatrician. I also got the vaccine. I have the distinction for being the first person at Jericho Road to get the vaccine. And I got the vaccine largely for personal reasons, of course. For those of us who are providers, on the front line, we encounter people who may be infected all the time. I said early on in the pandemic that the question was not so much if I get exposed, but rather when I get exposed, because the manifestations of the viral infection itself are just so basic and mundane and common that people would come into the office and not know that they had COVID, and then find out after the fact that they had been infected. And so I wanted to have the vaccine as a means of protection for myself so that I could continue to work. So I've had both doses of the vaccine, and probably I also have had a good response. That is to say that my arm was sore after the first dose of the vaccine, which I just thought was related to having any kind of puncture wound in your arm. So whether it was a COVID vaccine or a flu vaccine or a tetanus shot, your arm is going to hurt for a day. And that's what happened. And then the next day, my arm was fine. And similarly, after the second shot, my arm hurt. And I felt a little, I felt that I wasn't as intellectually sharp as I typically am. My sense of humor changed for 24 hours. But after that, after 24 hours, I could feel that I was back to normal. And so for me, taking the vaccine was really not much more than a walk in the park. Now, some of the questions that we have relate to how should I behave after getting the vaccine? And certainly as a person, as one who is now protected, I took the vaccine, I've built up antibodies against that core protein and so forth. But I still wear a mask, and I wear a mask, not so much that I worry that I'm going to infect someone, but to send the message that you don't have to worry about me. So often when the mask is off, there's a discussion. Are you going to make me sick and those kinds of things. And so, yeah, I can tell people that I've had the vaccine, and some people say that's great, and other people say, yeah, sure. But the fact of the matter is, by wearing the mask, it just further minimizes exposure to other people. I think it's important to understand too that all of the research data show that cloth surgical mask is the preferred mask for the general population. We know that folks who work, in the clinic in high risk areas, that the N95 is the gold standard. But for those of us who are, whether you're going to the store or whatever, that bluish surgical mask is the best protection that you have. The more you have, the better. But I would say too that some of the ones that are, sort of designed on someone's, the fashionable ones that are designed on a sewing machine probably are not the best that you can do. So if you can wear a surgical mask, those blue ones, those are probably better. Certainly maintaining your distance is another, just a guideline. And it's really common courtesy. I don't know. I walk down the street in the morning and if you walk past somebody who is smoking a cigarette, whether they're 5 feet in front of you or 10 feet in front of you, you notice that cigarette odor. And so you know, there are all kinds of data that show that, you know, if you sneeze, your droplets go farther and so forth. But, you know, just as a matter of common courtesy, maintain social distancing where you go, if that's at all possible. It's also important to understand that by working in this high risk environment that we have, if somebody comes into the office, happens to have a COVID exposure, and so that you then become secondarily exposed, you know, there's the possibility that for a short time you may have that virus in your nose. It doesn't mean that you're going to get sick, but it does cause the theoretical concern that if you sneeze, you might sneeze out viral particles. So again, wearing the mask is very important. Maintaining social distancing is very important. And just be considerate of others. I think that really is the message that I would like to convey, is that we be considerate of others. You know, our freedom ends at someone else's face. And so it's great for me to know that I'm protected against COVID and all of those kinds of things, but I don't want to flaunt my protection at the expense of relationships that I have with patients that I encounter, or, you know, just people that I encounter in the neighborhood. You know, it says here, questions about race and ethnicity. And there are data that are coming out that show, at least in the general population, that people who identify as white have been more likely to be vaccinated than people who identify as persons of color. And I talk with, you know, my environment is a pretty diverse environment, but, you know, when I go to the barber shop, you know, my barber is a brother. And so when I talk to him and guys in the shop, it's like, so are you getting it? And it's like, I don't know. I want to see. I don't think it's been tested enough. And besides, you know, people of color have been experimented on. And I just want to address that because that is an emotionally charged, sort of provocative kind of term. As a person, you know, I worked in genetics at the university for 30 years. And I just need to emphasize that the rigor, the diligence that research protocols go through when it relates to human beings. You know, we don't want to pay people to get a vaccine. We want people to be fully informed about the vaccine so that a person can make a reasonable choice. And as we've said all night tonight, you know, like I think in the Pfizer group, about 20,000 people were in the research group, and in the Moderna group, another 15 or 20,000. So that's like 30 or 40,000 people who were in the treatment group. And then there was the comparison group of another 30,000. That's a lot of people. And so the research is pretty strong that the vaccines do protect us from having COVID and getting some of the complications, especially hospitalization and death. On the other hand, you know, we know that here in Buffalo, we know where the high risk zip codes are. We know what the high risk professions are. I just talked to a grandmother this morning. She's a frontline worker in a hospital, and she still hadn't gotten the vaccine. And, you know, I just told her, I said, listen, you know, I did this for selfish reasons. You know, I want to protect myself, and I want to have that option to go visit my grandchildren. Now, some might say that's really, really selfish because, you know, I've said nothing about looking out for the public good, but there are benefits to having been vaccinated. And so I think that's really, really important. I think that part of the reluctance that I sense is just what my partner said. Well, I was at the barbershop and I heard that this, or I was at the beauty salon and, you know, and my sister friend said that. You know, I think that those are probably some of the things that influence our decision making that are greater than the things that we might think about critically. And so my encouragement tonight is that we do think about these things critically. I think it was Takesha that was saying, that COVID, you can have just a loss of smell, or you could wind up in the ICU, but you never know which that's going to be. On the other hand, having that vaccine, it's 2 seconds or whatever of that puncture and another puncture in 28 days, and your health is going to improve. And so you don't have to worry about whether, if I come in contact with COVID, I lose my sense of smell, or whether I'm going to wind up in the ICU on a ventilator. Allana, are you there? You want to talk about why you took the vaccine?
Oh, sure. Yeah. I mean, I think I guess I didn't talk about it completely why. I mean, I think for me, like initially, because I'm pregnant, I was like, oh no, I'm not going to get it. But then I researched more. That's kind of who I am. I researched things a lot, and looked into it, talked to a lot of people, looked at the data that came out of the FDA briefings, and really evaluated the risk. And I think for me, I mean, I work in the hospital sometimes with COVID patients. And, sometimes you see people and you don't even know they have COVID. Like that happens a lot too. You spend 45 minutes with someone doing something and then you find out later they had COVID. So for me, for sure, that was I felt like my risk was definitely there. And I think the other thing is that for those of you who aren't working directly with COVID patients, the risk is still there, especially with these new variants that have come out that are more contagious. And we don't really know what that looks like yet. The CDC just recommended people wear 2 masks instead of 1. And that was enough to convince a patient of mine that he should get it. He's like, I can't even wear 1 mask. I'm not wearing 2. Okay, I'll get the vaccine, he said. So, but yeah, I mean, for me, like, I have 2 kids. I decided it was more important to take the vaccine and avoid severe COVID and not risk, dying myself.
So I think that's a good point, Allana, and that's a good segue into, getting our, going into our Q&A. But, just to add, there's a lot of stuff out there. There's a lot of rumor. You read social media every day, the COVID vaccine is causing something else. What I would recommend, and I just highly suggest, guys, talk to people that you trust. Like, talk to your doctors, talk to your sisters and people that you trust that have received the vaccine, that can give you adequate information that makes sense. Now, we don't want to discount the medical history and the Black and Brown communities. Like it happened. It's not like, these are things that made up. So we understand the apprehension. We do. Like Dr. Robinson was saying, we understand. I think this is different. And the reason why is because COVID did not pick a certain race or a certain gender or a certain nationality, culture to affect. It impacted all of us, Black, white, brown, culture. This was a pandemic that affected everyone and touched everyone in some sort of way. I mean, if we all think, we know at least someone that had COVID, that may not have done well from COVID, that may have even died from COVID. It impacted our lives in so many different ways. So for me, I have 5 boys, but I also have a lovely practice that I enjoy going to, that I enjoy talking and seeing my patients every day. And so I have a commitment. I have a commitment to my family. I have a commitment to my community. I have a commitment to my patients to be the best that I can when I'm presenting myself to them in that room. In addition to that, the studies are showing there's things called post-COVID symptoms, and they can range from mild to severe, meaning that you had COVID and maybe you didn't even have a severe case from it, but you have all these side effects that are still lingering after the virus is supposed to be gone out of your body. That can include a persistent loss of taste and smell, headaches, fatigue. I mean, people that were running marathons and doing all these amazing things are now limited by this COVID vaccine, by this COVID virus that they had previously. And so, it's really important, guys, that you do your own research, that you ask the right questions, but that you really think of the risk that you're taking by not getting vaccinated. because getting COVID is a huge risk, and you're taking a huge chance on your life. And so I think that was one of my main reasons for getting it. It just wasn't a chance that I was going to take, that my kids would have to, end up without a mom. And so, yeah, that was my main reason.
I think one of the other things too is how we interpret the data and the statistics. When one talks about, I've got a 3% chance of getting COVID, for those of us who work with people, work in clinical medicine, 3% is a number that can be realized. It sounds like it's a very small number to us. I mean, you say, well, Jesus, I got a 3% chance of getting it, then I got a 97% chance of not getting it. I mean, and if you think about that like the lottery, you say, wow, I got a 97% chance of hitting the lottery. I'm just buying one ticket and I'm only filling out the top part, right? But when you're thinking about taking care of people, it's completely different. And 3% is a big number, and it does worry us. And we do see people who were previously healthy who are laid flat because of COVID. And we've seen, I thank God for Takesha. Takesha is in that isolation unit. She is looking, I was going to say looking the devil, but she is looking into the face of death every day. And so I'm thankful that she's got that. I'm thankful that we have the vaccine to keep us safe. So I think that one of the questions, I don't see anything in the chat yet, but I just hope that, we can have some discussions about the things that do concern us. If it's like, I'm still thinking about what happened, with a research protocol that didn't work or whatever. We need to have that discussion, because it is, we as, the provider team, we have taken the vaccine because we have looked at the research and because we have looked at the data. And so those are the objective kinds of facts. And then, we add our personal wishes, for protection for our family. And that's why we've gotten it. And so if there are questions that need to be answered, we are really very excited about answering. I'm not trying to coerce anybody to take the vaccine. I would not tell anybody to take the vaccine against their will. But at the same time, it does hurt my heart when I see people who are at risk and know they are at risk, and yet are not availing themselves of the available technology and the available vaccine. We are thankful here at Jericho Road. We're blessed that we can offer no barrier testing. And we are committed to making our community safe. We know for a fact, if you just look at, I call them the scourges of mankind, whether it's cancer or diabetes or heart disease or whatever it is, they adversely affect and impact communities of color more than the majority community. And so it just pains me that knowing all of these things, even the people, my friends at the barbershop know these things, and yet not to avail themselves of state-of-the-art care is something that is very bothersome to me.
So we do have some questions. Sorry, did I cut you off, Takesha? Did you want to say something?
No, I'm just getting ready for our questions. I'm ready.
Okay. So, and also I apologize if there is like a lag when I'm talking, because my internet is a little spotty right now. All right, so first question. Is actually not something that somebody submitted, but town hall meeting, and Allana actually mentioned this in our last town hall meeting, and I thought it would be helpful. Oh man, I hope you can still hear me, because it just told me that my internet connection is unstable.
We can hear you.
Okay, good. The question is, in general, in vaccines, not specifically the COVID vaccine, but just vaccines in general, how long it takes, like what is the usual timeline for when side effects will pop up? Because I remember you talked about that previously, Allana, and that really addresses people's concern that the vaccine hasn't been around that long. How do we know that like something strange isn't going to happen in 6 months or 2 years or something like that?
Yeah, sure. So most vaccine side effects will happen really within the first week. And those are redness, pain at the site of injection, muscle aches, fever. Almost all side effects will occur within the first 4 weeks. And there are some delayed reactions like fever or rash that can appear in that time, 1 to 4 weeks after administration. It is rare for side effects to occur beyond 8 weeks after vaccination. And at least in the Pfizer and Moderna studies, and what we can see is that people were followed for at least 8 weeks. So they were followed for that time period when we would expect to see essentially almost all vaccine side effects. And so if you are someone who's concerned about vaccine safety, there are good resources from the World Health Organization and CDC.
Great, thank you. Okay, so next one. What is the best way? So we have two that are kind of similar. What is the best way to explain to someone who doesn't understand the science behind the vaccine that the vaccine is safe? And then another person asked, what is the best way for health professionals to encourage vaccine hesitant people to get the vaccine?
So I can answer that, Mary. So I think that you point them in the direction of the data, but also, you know, for the health medical professionals, make sure that you know the data yourself. And I'm not talking about like the nuts and the bolts of every, you know, mRNA and all that stuff, but just the generalized data. What populations were in the study? What were the outcomes of the study? And then I think the best testament to all of this is that if you received it yourself, you can speak to it. So when I'm in the room with my patients, the reason why I encourage the vaccine, and I'm like Dr. Luther, I do not convince, I do not push. I tell them about the vaccine, I answer all their questions, and then my job is to try to make sure it's available when they do ask for it. But I can be a testament to what this vaccine does, how it works in our bodies, what were the side effects. I mean, just being very transparent and honest. But I'm also one that seeks out research. I asked my friends that got it. I wanted to know what they thought about it. I wanted to know what their experiences were. And that way I can sit across from my patient and give them a true and honest answer. And I think as medical professionals, you know, in order to do that, you know, I mean, I wouldn't promote anything to my patients, honestly, guys, that I wouldn't do myself. And I believed in the science. I believed in the research. I asked my own questions. I did my own, you know, history and background and all that stuff before I decided to get it. But I think that the best testament is, you know, going to people that you trust and not looking at all the internets and the social media and all that stuff, because a lot of that stuff is false, guys. So,
you know, I think too, the other is just as you say, you know, it's like whenever you get a puncture, you're going to hurt. But that's, you know, that's a side effect, but it's a manageable side effect. Or, you know, feeling a little bit not yourself, that's a manageable side effect. And, you know, it's, you know, those are, you know, I mean, it's like for me to just sort of feel a little bit calm rather than energetic for 24 hours and still be able to carry on my life is for only 24 hours, I was symptomatic. That is so much better than my worrying about winding up in the hospital, can't breathe, you know, all of those kinds of things. And so, but again, it really is about asking those questions about what information do you need, does the person need to make an informed decision? And we all know, you know, it's like they tested lots of people. And yes, you know, they talk about how hurried this process was, but the process was hurried because there were so many people who were sick and dying and so forth. And so, you know, the part that was shortened, if you will, was a lot of that committee work that Dr. Krolikowski was talking about. You know, I mean, the thing that sort of hangs up medication development and drug development is a lot of the committee work after the science to make sure that, I mean, we talked about, we didn't include pregnant women, you know, and so it's like, maybe we could have done that. But the other side of that coin is would we do that to a pregnant woman? I mean, there are research studies, I mean, for a lot of medications, and women are excluded from participation. Pregnant women, rather, are excluded from participation. And so, there's some of the research logistics might raise questions, but I think that does not mitigate the fact that the vaccine is effective.
Okay, thank you. Next question. So there's a number of questions about eligibility, but I'm gonna group those together, I think, towards the end. So someone asked, are there any downsides to the Johnson & Johnson vaccine as opposed to Pfizer and Moderna? Or maybe just talk about the differences, if there are any.
Yeah, so, sorry. So the Johnson & Johnson vaccine is a 1-dose vaccine instead of 2 doses. And the effectiveness is lower in the 60, I think they said 66%, but that just means that there's more people who get the Johnson & Johnson vaccine who will get COVID. It doesn't necessarily mean more people who get the Johnson & Johnson vaccine will end up in the ICU or die. So all of these vaccines were designed to prevent severe COVID. And so even though you may have a higher chance of getting mild COVID with the Johnson & Johnson vaccine, there's no data yet that shows us that you have a higher risk of severe COVID than if you were to get the Moderna or Pfizer vaccines. So, and obviously when you see the 94-95% effectiveness of the Pfizer and the Moderna, and then you see 66% for Johnson & Johnson, you can easily think, well, it's not as good. But the truth is that that's way better than a lot of the flu shots that we give every season. So it's still a really good vaccine. And if that's the one that you can get, I would get that one. It is different in that it's an adenovector virus. And so it has a little bit different technology, but it does target the same spike protein.
Thank you, Dr. Krolikowski. This is an easy one. This will be a quick one, which I'm sure you'll like. What is the gap between the 2 doses of the vaccine, probably both for Moderna and Pfizer?
Mary, do you mean like the time period between each vaccine? Is that what the gap is? So
yeah, like the time between the doses.
Okay, so for the Moderna, it's 28 days. And for Pfizer, it's 21. And again, the Johnson & Johnson is just a 1 dose. And we really, really, really recommend that people who get that first dose get the second dose. It does have to be with the same vaccine, meaning that you can't get Pfizer and then go get Moderna. Like you need to have both of the same kind of vaccines. But remember that the effectiveness comes after that second dose. That's where you get your greatest efficacy, but we still want you doing all the right things and proper social distancing and all that stuff. But make sure you get that second dose because that's where you're going to get the greatest result.
Thank you, Takesha. So on the back of that, what are the chances of a vaccinated person being able to infect somebody else with COVID?
So that's a good question. It's none of the vaccines are 100% effective. So that means that you do still have a risk of, whether it's small or larger, you have a risk of getting a mild COVID. And if you did, you could pass it on to someone. So that is one of the reasons you have to keep wearing masks around people and continue to practice safe measures that we've been practicing, because even if you get the vaccine, there is a small chance that you could get COVID and then infect someone else.
I think this just sort of underscores the complexity of all of this. When we say, well, the Moderna and the Moderna and the Pfizer vaccines effectiveness is in the 90%. If it's a 95%, that means there's a 5% chance that you didn't generate that response. And you won't know that, of course. I mean, it's like you got the vaccine, you got both doses, you feel okay. But unless someone draws titers on you to know whether you're in that 95% group or the 5% group, one doesn't know. And so that 5%, again, is a clinically realizable number. And so that's sort of like the important thing. I mean, when we're talking about these numbers, we have to think about how this applies to living human beings. You know, no vaccine is going to be 100% effective. There will always be, whether it's a person's got some genetic trait or something else that renders them more susceptible. You know, there are just a lot of things about, you know, human beings that we just don't know from a biological point of view. And so, you know, I think all of us on the line, on the call, the Zoom tonight, just need to appreciate that the researchers have done their best. We as the providers are doing our very best to keep people healthy. But we know that our work is not perfect.
Thank you, Dr. Robinson. So I think I'm going to ask about the variants. You know, maybe just a general, what's going on with the variants? How does that affect, how may that affect vaccination efficacy? I know we don't know all the answers to that yet, but if somebody wants to speak on that, that'd be good.
I'm going to let Allana take that, and then I'll add when she's all done.
Sure. So we know that the vaccines are effective against the UK variant, which was identified in Erie County this week, and also the Brazilian variant. Now, as far as the South African variant goes, we do know that, like in the lab, there is decreased effectiveness against the South African variant for the vaccines. That being said, there's still production of what's called the neutralizing antibody to the extent that we would expect it to still be protective against the South African variant. That's a lot of science, basically just to say that we think the vaccines will be fine against the variants that exist right now. The companies are taking precaution to develop a booster if it's needed. But for now, it does seem that the vaccines that are currently FDA approved will have protection against those variants. The quicker we can get people vaccinated, the better, to try to decrease like future variants that that appear.
That's what I was going to add, Allana. Just like the more people that can get vaccinated, you know, we can stop the variants. So that's why we're really, really, you know, kind of pushing these town hall meetings, like allowing people to ask questions, trying to be as transparent as we possibly can. So that way we can, when you guys decide to get vaccinated, we can try to have it available for you and get as many people vaccinated as quickly as possible.
Okay, I'm going to go through some of the eligibility questions. Some of them are kind of specific, but is a person age 64 eligible to get the vaccine?
So a person 64 is eligible if they have a chronic medical condition. And I think I saw a question down there about that, Mary. So I'll just go ahead and tackle that as well. So these chronic conditions, I mean, they're on the list of the CDC website, but they do include like hypertension, asthma, diabetes. If you have a BMI of above 30, which kind of puts you in an obese category. And I know one of the questions were how do you prove that? Well, at Jericho Road, we're vaccinating our patients right now. So if you're a patient, we can tell you whether you're eligible or not. You don't have to prove any of that. But, you know, I mean, if you're outside of Jericho Road and you just need that documentation, medication, blood pressure medication, diabetes medication, you know, just bring in, you know, your last physical showing your BMI. I mean, I think any of those things would kind of work at one of the vaccine sites. But I'm sure that when you register, they're asking questions like that. But So yes, a person 64 is eligible if they have the chronic medical conditions at this time. So we're hoping, guys, that that'll change soon and we can open it up. I mean, we want to vaccinate people. Like, that is the goal of this. That is the goal of what we're doing. But we do have to follow federal and state guidelines. And so that's what we're doing. So
I'm going to put in the chat and on the comments on Facebook the link to, I think it's the state like eligibility quiz. I recognize that some people who are asking these questions may already know about that and just find it confusing, but that is available to people. So these two questions are kind of similar. One is specific: when can a healthy mid-20s Jericho Road patient get the vaccine? And then another question: what does the timeline look like for vaccines for non-vulnerable groups?
Yeah, we don't really know the answer to that yet. My guess is April, but that's just a guess. It'll depend on the state.
And I mean, at Jericho Road, we are advocating for you guys. I mean, we're advocating for our patients. We're advocating for the communities all the time. I myself sit on a New York State COVID Vaccine Equity Task Force, and that is what I'm doing week after week after week, talking about why we need vaccines, talking about why we need to vaccinate our communities, talking about why we need to remove any barriers, such as what we did with our no barrier COVID testing, so that we can get as many people vaccinated as possible. So just know that, I mean, whether you're a patient or not, there are people on the ground that are working to get this done. We know that this is a lifesaver, and we know that we need to vaccinate as many people as we possibly can. And so, I mean, there are a lot of people working on this, guys. So, unfortunately, the demand is greater than the supply right now, but, that seems to be picking up as well, like Allana said. So, I mean, as soon as the word is out that we can vaccinate our communities, we're going to try to figure out how to do just that.
Someone said, I heard that there's an open clinic in Buffalo for vaccinations this week. I'm going to guess they're probably talking about the Delavan Grider site, if somebody wants to talk about that. I know it's not our site, but I know you know about it.
Yeah, so there's an open clinic. Again, you have to meet those guidelines, so 65 and above, elderly, and you have to, have some chronic or comorbid conditions. But like I said, if you show up, anyway, when you register, they're asking you all these questions. They'll let you know if you're eligible or not. But it's open, and if you can get to it and you qualify, absolutely. I mean, get vaccinated wherever you can. Get vaccinated.
I think I only have a couple more questions. Oh, there's more coming in. What is the effectiveness for the vaccine for people with chronic conditions like diabetes?
So, go ahead, Dr. Robinson.
I was just going to say that in the research, there were people who had these various conditions, and so the data, again, that's the observation that for Moderna it's about 95% effective, and for Pfizer I think it's like 93% effective or something, and so that's pretty good effectiveness. And again, you just have to weigh if you have comorbid conditions. And I think for those of us who are in that senior part of our lives, many of us do. I suffer from high blood pressure. I suffer from asthma. I feel great. I take my medicine and I feel great. But I also know, but that's a risk. And so, whether or not I'm wheezing, it really doesn't matter. This COVID vaccine can prevent being tipped in that direction. And I think that's another thing for everybody to understand, is that if you have these underlying conditions, you may be feeling well if you're taking your medicine. And if you're not taking your medicine, maybe you don't feel so great. And that COVID infection can just tip you into the critical ill category. And so, you see all this conspiracy theory about how they're faking all the results and all those kinds of things, but it's not so. They say, well, COVID only kills a few people because the other people had diabetes. Well, the fact is, if you have a medical condition like that, COVID can save your life. And so, it's just that simple. So please, again, as Takesha said, as Allana said, seek out the information, talk to trusted providers or your trusted friends, and look out for yourself.
Okay, last couple questions here. Does Jericho Road have enough vaccine supply to get 2 rounds to everyone who will be scheduled?
Yes, that is, that's one thing that the state has been pretty clear about, is that they will send us second doses when it's time for the second doses, and they have been. And then that allocation is for second doses only. We're not permitted to use them for first doses.
Someone asked, is it true that the vaccines differ on different continents or in different countries?
So, I mean, there are other vaccines being tested, but, you know, if it's, Moderna is mostly in the United States, but you'll see like the Pfizer BioNTech vaccine is being given across Europe, and I'm not actually sure what they're giving in Israel and other places. But if it's the Pfizer vaccine, it's the Pfizer vaccine wherever it is. So it could be that there's other vaccines that have been approved in other countries, although I don't think the Oxford one's been approved. I'm not quite sure.
I think this is the last question, unless I get any in the next minute or so. But as a patient of Jericho Road, how soon can I get vaccinated if I try to make an appointment, if I am eligible?
Sorry, I was muted. Yeah, that's as soon as next week. I mean, if you want an appointment, we're scheduling now. So you let us know. You call the office, and we'll get you scheduled as soon as possible if you fall within those guidelines. So we are diligently trying to get our patients vaccinated. And in fact, we are individually calling people that meet the criteria one by one, day after day, trying to get our patients vaccinated. We are serious about this, y'all. We are trying to get people vaccinated. We have the vaccines now for our patients, for our communities. We want them to get vaccinated. So if you did not receive a phone call, you can absolutely call Jericho Road and get on the schedule as soon as next week to get vaccinated. DR, I do see your hand up. I don't know if Mary sees it. You got a little yellow hand kind of waving around there. So I'm going to let Mary.
I did not see that. DR, if you have a question, I'll unmute you.
It's already answered though. That was the
it's already answered?
Oh. Yes, but the thing is, part of the one I asked like about the vaccine is different from continent to country, because my country right now is in Senegal. I think they send vaccines over there, but it's a big problem there, because like, I don't know, people talk about like the vaccine they have in these Western countries and the one they take to Africa is different. Like it's I don't know. I don't know, but that's the problem there, because they don't trust at all the companies. They don't trust. I don't know. So, but I'm ready to get vaccinated because I got my appointment already. So
good for you. I'm glad to hear that.
Okay, thank you.
Go ahead, Dr. Luther.
I was just going to say that internationally, there are other countries. I think Russia has a vaccine that hasn't been studied nearly as well as ours, and yet they are sending their vaccine, or other countries are purchasing the vaccine. So there are different nations that are doing this, and certainly how that works is higher than my understanding, but I do know that there's an awful lot of variation in vaccines and in, based on really geopolitics. I mean, Russia does not want to be outdone by the United States. And so, they may well do whatever they need to do to say that they have a vaccine just to be in the competition. And I think that their standards as far as research, particularly with respect to humans and human rights, is probably not nearly as stringent as it is here for us here in the United States.
Well, I am amazed that we managed to nail exactly an hour with the questions that were coming in. So we've gotten through all the questions. Thank you to our panelists. Do any of the three of you have anything that we didn't cover or anything that you want to say before we close?
I would just like to say, guys, you know, we tried to provide you the best information. Hopefully we can have more of these in the future. Go to trusted people. When it's your turn, get vaccinated. I think it's the only way that we're ever going to get back to some sort of normalcy. Do it for yourself, do it for your families, do it for your communities. But thank you all for coming tonight.
Okay, great. Well, I just want to thank everybody for coming. A recording of this stream will be immediately available as soon as we close on our Facebook page, and probably tomorrow or the next day on our YouTube channel, in case you want to watch it back or share it with other people. Again, thank you to our hosts for sharing their expertise and their own personal experiences with the vaccine. Thank you to all of you for joining us tonight, and maybe we'll see you again in the future. Thanks a lot. Have a great night.